Hello everyone, welcome you all to another session with Dr. Karthikeyan sir. Today we are going to discuss on role of functional rehabilitation on Parkinson. For today's session, we have our resource person Dr. Karthikeyan sir, who is working now as a physiotherapist at Nimhans. Over to you, sir.
Yeah. So I'm going to start. Very good evening, one and all. My name is Dr. Karthikeyan Thangavelu. Currently, I'm working as a clinician cum researcher at Nimhans, Bengaluru. It is fully funded by Government of India. My topic name is the role of functional rehabilitation on Parkinson disease. The functional rehabilitation means it indicate especially physical therapy assessment and physical therapy management. Today, I am going to take a lecture, the role of functional rehabilitation on Parkinson disease. Before that, I wanted to define what is Parkinson disease. Parkinson disease, it is an extrapyramidal system disorder, mainly which is characterized by tremor, rigidity, bradykinesia, dyssteatokinesia, followed by short shuffling gait or festinant gait. This literature consists of, there are three objectives. The first objective, mainly focusing the most commonly used therapeutic intervention strategy applied within the Parkinson disease functional rehabilitation are presented along with their definition, principle, and advantages. The second objective, clearly established evidence was defined that have been addressed in systematic review, meta-analysis, and showed positive results. There is a limited evidence which was defined, found in randomized clinical trial or other studies. The next slide, the main symptom of Parkinson disease, being a physiotherapist, these four symptoms we used to deal through some physical therapy approach. The first symptom is we simply called as, everybody should understand TRAP. T stand for tremor, R stand for rigidity, A stand for akinesia, P stand for posture and balance. There is a loss of tremor, means it is a shaking. Parkinson, also called as shaking palsy. Initially, it occurs in the unilateral, followed by bilateral. Rigidity means it is a stiffness of the limb, neck, or trunk. Akinesia, there is a loss of voluntary movement. A means akinesia, the loss of posture and balance. Along with, if you taken, especially the flexed posture, you can able to see in this picture, second picture, the forward tilt of the trunk, reduced arm swinging movements, the lower extremity, which indicating short shuffling gait with short steps or festinant gait. The rigidity and trembling which occur in the upper extremity, tremor which occur in the lower extremity, arms are flexed at the elbow and wrist flexed position, masked face, stooped posture, and tremor which occur in the face also. There is occur in the chin, jaw, this area, generally the tremor which occur in the back of the head also, which used to happen. So that any Parkinson disease, the main symptom, being a physiotherapist, we must treat, especially TRAP. T stand for tremor, R stand for rigidity, A stand for akinesia, and P stand for posture. This all it will be seeing in the practice of the Parkinson disease. The Parkinson disease, it is a neurodegenerative disorder. That is a definition which is characterized by tremor, rigidity, bradykinesia, dyssteatokinesia. short shuffling gait, and feshionant gait. The next slide, which describe about, there are 6 cardinal symptoms. Along with the 2, one is flexed posture and freezing. That is a motor block which occur in the body, especially upper extremity and lower extremity. Then cardinal symptom of tremor. Tremor may be considered to be the most typical sign of Parkinson's. It occurs mainly in the forefinger and thumb. The intensity of tremor 3 to 6 cycles per second. It will happen in, then it will on and off, it will be there. The tremor also occur in the head, lips, chin, and jaw. Tremor is more likely to be presenting symptom of the Parkinson patients. The next, rigidity. Rigidity is increased resistance throughout the range of motion. There is a resistance throughout the range of motion. It occurs mainly, it starts from the proximal area, followed by neck, shoulder, and hip. Gait is short shuffling, feshionant gait, narrow base of support, and flexed knee. These are all the gait of the Parkinson disease. The another cardinal symptom that is called as Camptocormia. The patient on the left hand, Camptocormia due to unrecognized or untreated Parkinsonism. The picture on the right depict his response to a single test or assignment. Camptocormia is a postural deformity. Camptocormia, it is occur entire post, it will disturb. The manifestation of the Parkinsonism is often dismissed by physician or hysteria. The freezing, it is a motor block. Most often leg during walking, it occur arms and eyelids. Freezing means it is a sudden transient inability to move. It typically causes hesitation when initiating walking, sudden inability to move, feet when turning or walking in narrow passages such as doors or elevator, or when patient about to reach target destination. Freezing is thought to related to noradrenaline deficiency related to degeneration of the locus coeruleus. The next slide, the mainly freezing, mainly affecting the antagonistic muscles. Either it will be left side or right side or left, right, simultaneously it used to happen. Walking to the music or metronome, shifting body weight, rocking movement to trunk, train your patient to perform antagonistic strengthening muscles. These are all the activity which you have to perform. It will help to reduce the symptom of motor block symptoms. Another the important symptom, the post-development Parkinson's, mainly Parkinson-induced depression. The Parkinson-induced depression, which was identified in 2003, some German-based physical therapist along with some neuropsychiatrists, they have identified the Parkinson people used to develop some sort of Parkinson-induced depression. The Parkinson-induced depression, which is handled some of the technique, which is called as progressive muscle relaxation, autogenic training, visualization, biofeedback. These techniques which will help to reduce the depression, Parkinson-induced depression. It was published in the Geriatric Psychiatry and Neurology in 2003. So those approach which will help to minimizing symptom and maximizing function. The next slide about what are all the role of surgery, neurosurgeon. The neurosurgeon, they used to perform especially pallidotomy operation and deep brain stimulation It will help to the Parkinson patient post-development sleep disorder, Parkinson-induced sleep, that also which is taking care and which is managed through deep brain stimulation. That will help to good quality of sleep. It will give the good health, quality of life, better life. If you approach deep brain stimulation, there is evidence-based management for the Parkinson's conditions. The next slide, the physical therapy. Physical therapy, it is a key role. Physical therapy, it manage especially brain-related dysfunction, especially Parkinson cases, sensory evaluation, paresthesia, manual muscle test, range of motion, functional reach test, TUG, timed up and go test, followed by dynamic posturography, 10-meter walk test, walkie-talkie test, 6-minute walk test, functional independent measures. These are all the PT assessment, the physical therapy used to evaluate, especially when the Parkinson patients coming, they used to evaluate this. I already told you there are 4 clinical symptoms, which is a prominent symptom. One is tremor, rigidity, akinesia, and posture and balance. This will be using some of the physical therapy exercise, some of the physiotherapy equipment, which will help to manage, to assess as well as treatment, along with the gait ride system. This will also play a assessment as well as treatment care, especially Parkinson management. Being a physical therapist, when they are doing the clinical practice, the Parkinson patients, they used to during the clinical practice, they used to face this kind of problem list. First one is their joint range is completely reduced. The second one is their muscle strength totally impaired. Third one is abnormal posture, either stooped posture or flexed posture. They lost the balance, they lost the gait, especially walking pattern or locomotion. They lose the fatigue, they develop the pain. There is a lack of aerobic capacity. So being a physiotherapist in clinical practice, if you identify this problem, you can deal with a physical therapy approach to reduce the symptom and maximizing function for the key management in the therapeutic care. The next slide about what are all the aims of physiotherapy. So the Parkinson patients, we need to create some goals to achieve our challenging task. One is how to improve the joint range and how to improve the mobility, how to strengthen the weak muscles, how to improve the postural correction, how to improve the balance, how to improve the walking pattern, how to reduce the fatigue, how to reduce the pain, and how to improve aerobic capacity. The joint range and the mobility. Recently, there is a evidence-based protocol. The protocol name is multi-modal exercise, which will help to improve the joint range and mobility. According to strengthen the weak muscles, the MCR grading, there is a graded exercise. One is zero, no muscle contraction. One is flicker up contraction. 2 is full range of movement with equalizing gravity. Full range of movements with against gravity with resistance, normal condition. So according to the muscle is completely paralyzed. Being a physiotherapist, we used to give the passive graded exercise. Then the muscle, little power is there, moderate power. Then we can deal with the active assisted exercise. Little more strength, then you can approach with the assisted and resisted exercise. Almost the muscle between the complete strength through below strength, we can approach some of the therapeutic goal, that is called strengthening exercise. The last one is we can make the patient, especially once the patient able to walk independently, they may develop or they may develop some sort of balance, gait issues. So being a physiotherapist, they should go and take the advices, and they have to correct their gait, they have to correct their balance, they have to correct the walking pattern, they have to correct the tremor, they have to correct the rigidity, they have to correct the bradykinesia. This is the treatment goals. The therapeutic effectiveness of physical therapy. Physiotherapy is unlikely to impact on three key motor signs. That is, I already told you, trap. Don't forget it. Parkinson's means trap. Tremor, rigidity, akinesia, and posture and balance. So being a physiotherapist, you need to identify which area they have lost the balance, what is the posture, you can quantify, and according to evidence-based exercise, we have to teach the patient and ask them to perform, ask them to repeat, but they should perform under the supervision of some physical therapist, they have to perform. The next slide about the what are all the exercise. The first one is, first approach, physiotherapy approach is relaxation technique. The relaxation technique which will help to minimizing symptom and maximizing function of the Parkinson's disease. So what are all the relaxation exercise? One is deep breathing exercise. Some of the incentive spirometer. Then we can teach. Suppose the patient is lying. The lying position, especially crook lying. Crook lying, ask the patient to take deep inhale and exhale. That will help to give the complete relaxation on the brain. It will reduce the stress, it will reduce the anxiety, it will reduce the depression. The next slide about, these are all the technique. The Parkinson patient, first position is, the patient is crook lying. Suppose the head and hip knee is flexed position. Suppose the head turn to right side, the flexed hip and knee go to left side. The next, we ask the patient to take the head should be left side and the hip and knee, the lower extremity, should be in the right side. We ask them to perform 5 to 10 repetition with the supervision of some physical therapist. After that, ask the patient to deep inhale and exhale. The same things, the patient, another relaxation technique is called as, the patient is crook lying, hip and especially lower extremity, hip and knee flexed to position. We ask the patient to take inhale and exhale. Suppose the left side of the upper extremity, it should be abducted and elbow is flexed, the wrist is extended. Then another, suppose left side is, the right side should be abducted, the elbow is partially flexed and the wrist is extended position. Opposite. The same things you have to repeat right and left, right side and left side simultaneously. One should be in flexed, another should be extended. Suppose right is flexed, left side is extended. Suppose other side is left side flexed, right side is extended. So during that time, we ask the patient to deep inhale and exhale. This will help to reduce the stress and ask them to repeat 5 to 10 repetitions. This is the relaxation technique. You can perform the same things in the side lying position. Suppose the uppermost part should be, especially uppermost part of the upper extremity, it should be flexed, followed by elbow should be extended. Same things we change. Suppose right lateral, left lateral, the elbow should be extended, elbow should be flexed. Those repetition we have to repeat 5 to 10 times. So it will give complete relaxation to the patients. So first our approach is which position is appropriate position. You have to identify and give the complete relaxation to the patients. The relaxation technique which we called as progressive muscle relaxation, autogenic training, visualization, biofeedback. The next slide about flexibility of the exercise. I already discussed the flexibility exercise mainly for graded exercise. You need to quantify the strength of the muscles. There is a MCR classification is there. According to MCR classification, you can approach or you can give the treatment to the particular muscles and particular group of muscles. Followed by, we have to give stretching. Stretching means stretching is a therapeutic maneuver designed to lengthen or elongate pathologically shortened soft tissues and thereby increase range of motion. Then strengthening exercise. Everything should be repeat and holding time. According to physical therapist, the muscle should not get fatigue. The muscle should not optimum level, which we wanted to achieve 5 repetition. Slowly you can increase the repetition up to 10. Don't go beyond 10. Then ask them to keep resting position, followed by you have to continue other short of exercise, other series of exercise you have to continue with the help of physical therapist supervisor. Some of the pool exercise, hydrotherapy also is more effective for the management of Parkinson's disease. The recent evidence which indicate the hydrotherapy will help to reduce the tremor, especially tremor and rigidity. If you apply TENS, the recent evidence, TENS also transcutaneous electrical nerve stimulation. The transcutaneous electrical nerve stimulation, application of pulsed rectangular wave via surface electrode through patient skin, if you reach, that is called TENS. That is also help to reduce the tremor, especially Parkinson patients. Another very, very important, the post extrapyramidal system disorder, especially they used to develop some sort of balance exercise. The balance exercise which will help to restore especially balance function, they frequently tend to fall. To prevent, being a physiotherapist, you have to advise the patients how to shift, how to rotate, how to put forward, how to stand. All those things you have to teach the patient to prevent the fall as well as to strengthen the lower extremity muscles. So adding some of the voluntary movements, especially arm clapping, arm overhead, single leg raises, head and trunk rotation. So these are all the warm-up exercise. Before attempting the balance exercise, you have to provide some of the warm-up training protocol followed by balance exercise. This balance exercise, it will help to prevent the fall as well as to improve the balance. Those exercise, the physical therapist, supervisor or physical therapist advises the patient undergo, and the repetition should be performed with the supervision of physical therapist. Stepping or marching in functional reach. Then posturography. There is a instrumental. These are all conventional way of managing the balance. The posturography, that is a balance master. There is a challenging task, especially it is pre-recorded. Some of the games, some of the challenging tasks the patient used to perform, they try to improve the balance of the Parkinson patients. Another conventional technique which we call as kitchen sink exercise. So we ask the patient to sit to stand. That is CKC, closed kinetic chain. Ask the patient to sit to stand, stand to sit, off kneeling. These are all the exercises. Ask them to perform 5 to 10 repetition. That will enhance to the balance, especially Parkinson care. Single limb stance, one leg marching. Then side kick. Ask the patient to stand, you kick in the sideways. Another back, you have to kick in the back side, you have to kick in the forward and marching in a single place. These are all the exercise. It will help to improve the balance of the Parkinson patients. Another locomotor. The locomotor also, one is conventional way of handling the locomotor, that is a walking pattern. Another one is instrumental device, that is called as gait ride system. So the gait is a rhythmic alteration of movement in both upper limb and lower limb. It consists of two types of parameters. One is straight length, step length, heel strike, foot flat, mid stance, heel off, acceleration, mid swing, deceleration. This is the gait parameter. It consists of swing space and stance space. Swing space which contribute in 40%, stance space which contribute in the 60%. So especially Parkinson patients, we used to give the confident, especially they used to develop short shuffling gait or fast-in-hand gait. Some of the physical therapy approach, it will help to correct the gait. So you need to identify which muscles. According to that muscles, you have to strengthen, followed by you ask the patient to do some of the balance exercise, then functional reach test, then 6-minute walk test, then other approach we called as treadmill. The treadmill also, it will enhance the walking pattern, especially Parkinson patient, to manage functional care. The locomotor training. Also, there is a conventional method of approach. Another one is instrumental basis. The instrumental basis also we classified into one is gait rate system and a treadmill. These things, it will help to improve the walking pattern, especially Parkinson's care. And the third one is posture. So they have the flexed posture. So we ask the patient to keep the both legs in wider base, ask them to straighten the trunk, keep the legs wider based, then we keep the patient for 5 seconds holding, then you can correct the gait, you can correct the posture. Another one is fatigue. Everything should be supervised and advised by some physiotherapist. If you did not follow or the patient did not follow the exercise, the patient used to develop some fatigue. So appropriate exercise we have to teach to the patients. So that is very important, especially Parkinson patients. So the next slide, which describe about what are all the adaptive and supportive devices. So when the Parkinson patient, if they are going to toilet, their toilet height should be adjustable and they should keep, because they used to develop tremor and rigidity. So the side rail, they have to grasp and sitting. So like this, if they created a toilet, it will enhance the patient and improve the bowel functions, and they may not lose the balance also. So this kind of assistive devices which will help for better quality of life. So this kind of toilet you have to create as the, especially Parkinson patients. And they have the shaking palsy. So they are unable to hold any object. So this kind of assistive device, some Velcro, you have to keep in the fist, and you can attach it with some of the spoon. Then they can use for eating purpose. So it will give the better quality of life. So especially some Velcro. So those activities, this kind of adaptive devices, which will give the better quality of life, especially Parkinson patients. And wearing the shoe or wearing the chappal, there is a instrument because they are having the shaking palsy, especially in lower extremity. They are unable to grasp the especially forefoot, midfoot. So some of the device, it will help to pull the foot in the right direction. And how to remove the socks. There is a device which will help to, because they are unable to hold. So some of the devices which will help to remove the socks. So these are all the assistive devices. It will provide better quality, overall health, livelihood of the Parkinson patients. So some of the balance exercise which I described. The first one is ask the patient to stand. In front of you have to keep some tables. Ask them to heel off. First, you have to repeat 5 to 10. Ask them to check. The second exercise, balance exercise, toe off. In front of the table, we keep the table with the support. So ask the patient to perform toe off. Another one is one leg marching. One leg completely stabilized with the ankle. The other leg you have to lift. That is one leg marching. Ask them to hold it for few minutes. So that will enhance the balance and better quality of the Parkinson patients. Another technique, this is with support. Without support, the physiotherapist, with the help of, that is a human crutch, with mild support. So one towel is required. Ask the patient to put forward in the right leg. That with the towel will be hold in the waist. Ask the patient to stand and ask them to repeat for 5 to 10 repetition. This is you can perform the physiotherapist standing position, the back side of the patient. One is back side, another one is front, another one is sideways. These three ways you can give the support. So this will enhance the balance activities, improve overall health, well-being of the Parkinson patients. So these are all the some of the balance exercise which will help to improve the balance of the Parkinson patients. So some of the new innovative equipment, one is electromyography, another one is gait rate system, another one is balance master. The gait rate system, it will try to compute assessment as well as treatment, both purpose. Balance master also, it will assess the balance as well as treatment purpose. So some of the new upcoming devices which installed some challenging games, especially Parkinson patients. So according to research purpose or clinical utility, you can buy and use for this equipment to manage the balance and gait functions. So it will help to improve the walking pattern. It will help to improve the balance of the Parkinson patients. Another one is treadmill. This is also another walking pattern, that is an instrumental device. So it will help, depends upon the patient's ability. It will try to keep the upper body some weight support, then ask the patient to walk with according to the speed. We have to start with the minimal speed and we ask the patient to walk. So the upper body will be completely supported by some of the weightlifting devices which will help to hold the upper body. So the patient is able to walk without anybody support. So it will create a confidence to the patients and improve the walking pattern. Another very, very important, that is a forced exercise, that is also called Movement. It's recently, it is developed. There is a tool which will help to support and improve walking ability, relax your muscle and muscle stiffness, improve physical performance, improve your overall well-being and physical activity. The forced exerciser, that is also called as movement. So it will strengthen your muscles, improve your coordination, and increase your individual step length. So it will focus especially balance as well as strengthen your muscles and the coordination. And how it will be help for relax your muscle, especially stiffness. So immobility and pain, physical activity can help relieve this symptom. It can help to naturally increase your metabolism and contribute to more mobile and active lifestyle. The third one is physical performance. That is a forced exerciser. It will help to mobility and blood circulation and improve the metabolism, and it will accommodate cardiovascular and respiratory system. The last one is overall health. So it is working on the neurotransmitters. It will help to release the endorphin, dopamine, and serotonin, and it will improve the motivation and it will improve the mobility, so overall health and well-being of the Parkinson's population. Another very important, there is a drug and L-toba, carbidopa, syntoba. This is already the food supplement. So if you consume automatically their food supplement, it will increase the L-toba and carbidopa food supplements. So it will help to reduce the constipation. So it will improve the overall health and well-being of the Parkinson patients. There is a very research outcome that is called as Cone-Yar classification disability scale. It consists of 5 categories. The first one is which is indicating minimal, absent, unilateral if present. The disability level first is minimal, very minimal or absent, or one side only it will be there. The second classification, the bilateral, it will be indicating, and the balance not impaired. So it involved bilaterally. The third is character, which indicating unsteadiness when turning or raising from the chair. They are unable to stand. Some activities are restricted, but patient can live independently and continue some form of employment. The fourth, which is indicating all symptom present and severe, standing and walking possible only with assistance. The last one confined to bed or wheelchair. The final fifth one is the patient is wheelchair bounded, which is indicating. So now another one innovative exercise equipment that is called as metronome. So it is mixed with the occupational therapy and physiotherapy. This equipment recently advanced, and they have identified in 2001 GODI. It is published in the Physical Medicine and Rehabilitation Journal. So this metronome, which will help to improve the quality and the overall health well-being of the Parkinson patients. And that is, we already discussed, it's supported with the development training. So one case report I wanted to give the. So a 58-year-old man with a 10-year history of idiopathic Parkinson disease. Idiopathic means pathologically induced Parkinson disease with incapacitating freezing of gait. These are all the symptoms they have reached to the Parkinson clinics. The patient had severe difficulties initiating gait and able to take only few shuffling steps when provided with the visual cue. Attempt to walk evolved rapidly into forward destination and ultimately a fall to the ground. Axial turning was impossible. However, the patient's ability to ride bicycle was remarkably preserved. Gait freezing required instantaneously after he dismounted the bicycle. The striking kinesia paradoxia may be explained by the cycle rotating pedals. So some cycling, it will help to prevent the Parkinson. It will help to it will help for treatment purpose also. So that is called MotoMet. So it is using for cycling. It can be arm rotators. It can be used for lower extremity rotators. So leg exerciser. So according to your requirement, you can buy and use it for Parkinson patients, especially to minimize the symptom and maximizing. So the trap symptom, it will be help to reduce. The equipment, that is walker. The Parkinson patient, this kind of walker is more appropriate tool to enhance the mobility. So the rolling walker and the cans and the grab bars, raised toilet seat. These are all the things it will give the support to the Parkinson patient, especially to prevent the balance. So some of the rolling walker for mobility purpose, we can advise the patient to use this because they may lose the balance. So this will help to keep the body in straight position and make the patient to move forward. That will enhance. So this is a clinical message through this lecture. So there is a neuroplasticity changes, especially occur in the basal ganglia by using some of the therapeutic application of technique, which will help to improve the Parkinson patients. We can advise some of the deep breathing exercise. So it will help to improve the it will help to reduce the symptom of stress. So it will help to improve the overall rehabilitation outcome, overall health, livelihood, restore cross and fine motor skill. It will help to enhance the balance. It will correct the gait. It will correct the posture. It will correct the coordination. It will help to improve the flexibility, and it will help to strengthen upper extremity and lower extremity of the Parkinson patients. So this functional rehabilitation protocol, you have to, being a physiotherapist, you need to select and you need to provide appropriate tool to identify which muscle is impaired or which muscle should be strengthened. The physiotherapist, under supervision, they have to perform. These are all the tools which will help to manage the Parkinson patients. And another, recently in China, there is a survey which was conducted by China-based Parkinson Association. They have found less people only developing Parkinson disease because they found to take especially green tea. So the green tea, it generate antioxidant, so it will not develop some sort of Parkinson disease, especially it will not disturb the basal ganglia. So the green tea is important nutrition supplement. It will help to reduce the Parkinson and morbidity and mortality of. So green tea recently identified there is a prevention of Parkinson disease. So how to prevent? When you are taking medicines, this much stimulation will happen. When you are doing some of the cycling, pedaling activities, some of the walking, jogging, these activities. So how the brain cells it's functioning, that is I'm indicating. So we wanted to fit for all overall health, keep on doing some physical activities, keep on engaged with some brain cells. So those activities, if you are performing, so you may not be developed some sort of Parkinson disease. So keep on doing some physical activities which will help to prevent Parkinson attack. So thanks for giving the opportunity to share my knowledge, especially how to manage being a physiotherapist, especially Parkinson condition, which I have found some of the evidence-based protocol which will help to manage the Parkinson patients. Once again, thanking you, the Movement Maestro Academy, given the opportunity to deliver this specific topic. It will identify some of the research evidence-based protocol. So those who are working as a clinical area, you can apply. These are all the instrument, conventional way of managing the Parkinson patients. Another one is instrumental way of managing the Parkinson patients. Some tools which is available, some of the research outcome which is available, especially balance. You wanted to assess Berg balance scale, then UPDRS, Unified Parkinson Disease Rating Scale, is mainly used for in the motor assessment and treatment effect. You can assess it. And FRT, Functional Reach Test, 6-minute walk test, and DGI, Dynamic Gait Index. So your approach, whether it is more significantly changes or not, you can use this research outcome or research tool to identify the effectiveness. Once again, thank you. My sincere thanks to Movement Maestro Academy. Sir?
Thank you so much, sir. Thank you so much for
Yes,
this
sir.
informative session. As like always, we are
Yes, sir.
getting great opportunity of learning with Karthikeyan sir
Yeah.
through this platform. So we are really obliged for that. In this small session,
Yes, sir.
hope
Thank you.
yeah. In this small session, hope you all get lots of knowledge about the Parkinson and functional rehabilitation protocols. Thank you, sir. Thank you again
Yes.
for your valuable time and
Thank you,
such a
sir.
wonderful
Yes, sir.
session. Thank you everyone for joining. Good night.
Yes, sir. Yes, sir. Thank you. Thank you. Good day, sir. Bye-bye.